Okay, so we're doing the systemic circulation, and the systemic circulation will start from the largest part, which is this part here, and this is the first artery that arises from the heart, which is the ascending aorta that come from the left ventricle. So this is ascending aorta. That will be the transverse or the aortic arch, and this is the start of the descending. Out of this, the part that belongs to the systemic circulation, and we're doing the arteries right now, will be this one here, this one, which is the first artery, the first large, huge artery that starts from the arch, and this is called the brachiocephalic trunk. Out of the brachiocephalic trunk, you will see right common carotid going up, and then right subclavian. And the left side is different. You see those two beside each other. This will be the right common carotid, and this will, the left common carotid, I'm sorry, and this will be the left subclavian. So remember, and the right side is different than the left side. Right side, you have the brachiocephalic trunk. That will give you right common carotid, right subclavian. On the left side, it is different. The left common carotid and the left subclavian will arise directly from the aortic arch. And how to recognize those from each other? The first one, you start from here, going up. The first one, it's a brachiocephalic trunk. The one in the middle, which is this one here, will be the left common carotid. And the last one, which is toward the descending, that will be the left subclavian. Okay. Right, so this will be the descending. If you look at this model here, this will give you the same thing, but it will continue even more. So this is the ascending. This will be the brachiocephalic trunk, just this part right here, starting from the aortic arch. It's the first one here. This is called the brachiocephalic trunk. Left side, you don't have it. So the brachiocephalic trunk will give you this, which is the common carotid, the right common carotid, and will give you this, which is the right subclavian. On the left side, it is different. As you see here, this is the left subclavian arising directly from the aortic arch, and this will, the left common carotid. Left common carotid will go up to the head and neck, up here. So this will be the left common carotid, and the left subclavian will be the last one here, and it will go toward the clavicle, and this is where the name came from. It will go under the clavicle, hence the name subclavian. So brachiocephalic trunk on the right side, right common carotid, right subclavian. Left side, you have the left common carotid and the left subclavian. Both of them are coming directly from the arch. And then if you follow it, this is the left common carotid. It will divide into external and internal. The internal will go in, feeding the brain, and the external will stay out to feed the head. So external and internal. If you follow down the subclavian, the name of the rest of the arteries will come from which region are we talking about? This part right here is called subclavian because the clavicle is like around here. So this is under the clavicle, it will be called the subclavian. The next part, which is this part right here, this is more toward the axilla, so we call this axillary. This part right here is on the brachium, and brachium means arm or the humerus, so this will be called the brachial. Then it will divide into two parts. This part is toward your thumb, so this will be the radius. This bone is the radius. How to know the radius from the ulna? The radius is toward your thumb. So this is the radial bone. So this artery here will be called the radial artery, and this will be called the ulnar because this is obviously the ulnar toward your little finger, and then we'll give you this, the palmar arch, and these are the digital arteries. So this is for the arteries of the upper limb. On the other hand, this artery here, which is descending, it's going down. Part of it will be in the thorax, and this will be called the thoracic aorta, and this part down here will be in the abdomen, and this is called the abdominal aorta. So descending, thoracic, abdominal. The abdominal will end up dividing into two parts. This part is called the ilium, this area right here. So this will be called the right common iliac, and this will be called the left common iliac. Out of it, you will see one going externally, which is this one here, that's called the external iliac, and the other one, which is this, that's called the internal iliac. And then it will continue down. This part here is beside the femur, so we call it the femoral artery. This part here is in the popliteal fossa, we call it the popliteal artery. And then the rest will continue down, tibial, which is toward the tibia, and the fibular toward the fibula. And then it will give you the digital arteries and the arch down here. So this is for the arteries. If you look at the veins, on the other hand, and I'm talking about the systemic circulation, not the pulmonary or anything else, so not this pulmonary. I'm talking about this and this. This one here, and both of them will drain the blood into here, which is the right atrium. So this will be the superior vena cava, and this will be the inferior vena cava. Superior vena cava will give you right brachiocephalic vein and left brachiocephalic vein, which is different than the arteries. Remember, in the arteries we said brachiocephalic trunk in the right side only, but in the left side you have the left common carotid and left subclavian arising directly. The veins are different. The vein right and left are the same. So right side you have the right brachiocephalic vein, left brachiocephalic vein, and then it will give you the internal jugular vein. It will be the external somewhere else, I don't see it here, but internal jugular, which is equivalent and beside the common carotid. And then the other one will be also subclavian, because it's under the clavicle. And as we go, it will be called the axillary, because it's in the axilla. And then you will have the basilic, and this one will be called cephalic. So this is obviously different than the arteries of the upper limb. It's different. So this one here is called cephalic, this one here is called the axillary, and the rest will be called basilic. And the basilic will move down, and it will divide into both of them actually will meet here, which is called the MCV, or median cubital vein. And then the vein on toward the radius will be called the radial vein, and the one toward the ulna is called the ulnar vein. Inferior vena cava is right here, and as you see here, it's giving you veins that go toward the kidney, which is called the renal veins, obviously. But the important thing is, as you go down, it will split into final branches, which is called the bifurcation. Bifurcate into two final branches, and this is exactly the same as we said in the aorta. The aorta will end up splitting into right common iliac, left common iliac, right external iliac, right internal iliac, left external iliac, left internal iliac. Same thing exactly for the veins. So this will be the right common iliac vein, left common iliac vein, right external iliac vein, right internal iliac vein, left external iliac vein, and this one here will be the left internal iliac vein, exactly the same as the arteries, and it's accompanied the arteries. And it will go down, as you see here, and this is the continuation of the external. So the continuation of the external iliac vein will be the femoral vein that will go down, and a branch that's called small saphenous will get out of it, and the other branch is called the great saphenous vein, and this will go down. Same thing, the one that toward the tibia is called tibular and fibular, and this will be the dorsal venous arch, which is this arch here, dorsal venous arch, and plantar venous arch will be on the plantar region. So there are two arches here. So and this one will be called the dorsal venous arch, and this is the last part of the venous system down here. If we go back to this part, we talked about it already, which is the right, the internal jugular, and then the external jugular will come out of this internal jugular here, and the internal jugular will get inside to get the venous drainage from the brain. The external will get the venous drainage of the head, just like what we said in the arteries, and this is a systemic circulation. If you're looking at these branches that are coming from the anterior aspect of the aorta, you will see this this is the celiac trunk, and it's called trunk because when you see trunk, it means that you will see branches after that. So this is the celiac trunk, and you will see branches coming out of it. Then you have this coming from the anterior aspect of the aorta, and this is called the superior mesenteric artery that will supply the intestine. Mesenteric is coming from mesentery, so this is for the abdomen, and this one down here will be the inferior mesenteric. So superior mesenteric is superior to the renal vein, inferior mesenteric is inferior to the renal vein, right above the bifurcation of the aorta. This artery here will be the deep femoral artery, so this is femoral right here, because it's beside the femur, and this will be the deep femoral. It's also beside the femur, but it's deeper and it will go down more. This is more superficial. And for this part here, this is called the palmar arch. There's a deep palmar arch and superficial palmar arch. It's not showing everything here, but it's showing one of them. And then you see these arteries here are called the digital, which are the branches that are coming from the arch.